good afternoon and welcome to our media briefing. This is our first media briefing since our Board of Supervisors meeting yesterday. And there were a lot of significant actions that were taken by the board yesterday, and so we want to kind of fill you in on what happened and what the consequences of some of those actions are. First, our board voted yesterday to move forward with a plan to accelerate our Stage 2 reopening by allowing such activities as dining in restaurants with reservations and shopping inside stores. This would be a big step in our recovery, but I want to make it clear that we voted to approve our plan and to send it to the governor for his approval. We believe we have met the updated metrics to accelerate further into Stage 2, but as of today, we do not have that approval. So please don't start lining up at your favorite restaurant or shop at stores. As soon as we have the go-ahead, we certainly will let you know. Another important action we took yesterday was to seek state approval of a pilot program to allow us to move into certain aspects of Stage 3 reopening. Now, Stage 3 would allow for the opening of hair salons and gyms with capacity restrictions, which I know a lot of people have been asking for, and also would include hopefully opening up swimming pools with capacity restrictions. We also need state approval for this pilot program, and we will let you know if and when that happens. We were only able to take these actions because of you, San Diego. It is because you took seriously the orders we have been putting out to avoid large gatherings, to maintain social distancing, and to use facial coverings. Your discipline, your cooperation, and your concern for fellow San Diegans has allowed us to keep our case numbers and our important metrics trending downward. We're not out of the woods yet, but we would have had a lot more deaths and a lot more cases if we hadn't strongly altered these behaviors and certainly the prevention efforts that we've all undertaken. Because we feel we're ready to move forward a bit. So thank you, San Diego. Lastly, there's another important action we took yesterday. Through this pandemic, the county and local cities have been on the front lines of this response. And while federal legislation was approved providing funding for counties and large cities such as the city of San Diego to cover the costs of their pandemic responses, that funding was not made available to the smaller cities within San Diego County. That's why yesterday I partnered with Supervisor Kristen Gaspar on a proposal to direct $25 million in funding to our region's smaller cities. This money will be invaluable and will help cities with expenses from law enforcement, sanitation, and even for economic support initiatives. And this is only the first installment. Governor Newsom has proposed using some of the state's federal funds for smaller cities, and we are hopeful that it will result in another $25 million for a total of $50 million that will eventually be provided to the smaller cities in San Diego County. I will continue to work with our local cities, those in my district in particular, to help them address the challenges presented by this pandemic. As I said from the very beginning, that we all have to be working together, and our board actions yesterday put our money where our mouth is. There are a lot more items that were covered yesterday, and at this time I'm going to call Supervisor Fletcher up to go into a little bit more detail. Thank you.
Thank you, and good afternoon. As a region, we have made great progress. When you look back on where we were at the beginning of this and you look at where we are today, we continue to see our region being a model for our response to this pandemic outbreak. But we want to make sure that that tremendous progress does not lull us into a false sense of complacency or a false sense of security. The reality is that without a therapeutic treatment and without a vaccine, we have to continue to adapt what we do every single day as we continue to move forward and coming out of the mindset we've been in, and we continue to ease some of the restrictions as we move forward. And in that mindset of adaptation, we want to talk for a minute about how it is we move out of this. We move out of this in the hopes of not triggering mass outbreaks and spreads by continuing the four corners of what we've talked about: physical distancing with non-household units, temperature checks by employers screening their employees when they come in to try and early identify those with symptoms and get them tested and get them in a state of isolation. The continued and rigorous use of hand washing, which we know is a very effective tool to stop the spread from your hands into your eyes, your nose, or your mouth, and then the utilization of face coverings. No one of these four things is foolproof, but it is about mitigating risk. And each of these four things mitigates the risk. And when all four are used together, it does provide significant protections. I know that the face coverings are uncomfortable, at times can be irritating, but rest assured, a face covering is a lot more comfortable than a ventilator. And so we continue to urge you to follow these types of things because it puts us on the path to continue to reopen. And we want to continue on the path that we've been on. We want to continue on the trajectory of moving forward and continuing to provide more openings. It is in this same spirit that we continue to remind San Diegans that mass gatherings are inconsistent with the public health order. We also want to remind you that mass gatherings are a place that triggers the majority of the outbreaks. We often hear that in today's environment and what we're dealing with, the largest number and most significant number of outbreaks are at congregate care settings. That is because that's the only place that's congregating. That's the only place where a significant number of folks are living in close proximity to one another. And so as you look around the country, you see other outbreaks happening at religious ceremonies and events where people are choosing to gather in time and duration and intensity in a way that helps facilitate the spread. And so we know that there is a desire to get back and move forward, and we're certainly moving forward, but it is really incumbent that we do this in a responsible way, that we do this in a phased way, and that we continue to move forward together. And so we want to continue the progress we've made and not be lulled into a sense of complacency and continue our path to reopening. Supervisor Cox mentioned the economic stimulus and humanitarian efforts we did with Federal CARES Act funding yesterday. He talked about the money that was made available for cities. In addition to that, we allocated $17 million for economic stimulus programs, in particular for our small businesses, and being mindful of the impact on all of them, but especially our hospitality industry that is probably going to have the longest tail in terms of recovery. We think that's an important part of what we're doing. Our board also allocated $15 million for behavioral health services, mental health, and drug treatment. We know that the number of tele-connections or remote connections has obviously gone up significantly with the coronavirus pandemic, but we need to provide help and support to our providers in technology and training. We want to help facilitate the teleconnection around mental health treatment and drug treatment in a sustained way to make sure that we can meet the need of individuals who are suffering and having difficulties out there, and we appreciate our board's support of that. We also provided $2 million in support for child welfare services. There's been a significant decline in the number of calls to our child abuse hotline, and that is primarily because the single largest entity that calls that line is teachers, who are mandatory reporters, and they observe kids who are in difficulty. When schools are not in session, teachers are not able to observe and they're not able to report, and we think that these $2 million will help us get more staff out, checking on kids, engaging with families, and doing everything we can to ensure that our children, particularly those who are in vulnerable situations, are cared for. And we think this is an appropriate use of the Federal CARES Act money and something that is vitally important. I wanted to provide some additional information on funerals. According to state guidelines, funerals are now permissible and allowed so that loved ones who have lost someone can be in a position to say goodbye and to have a proper burial. Funerals in San Diego County can be performed either inside or outside. We encourage outdoor ceremonies, outdoor remembrances, outdoor funerals, because it is less danger, but we are allowing either to take place. All those who attend must wear a face covering, and there must be 6 feet of physical distancing between household units. We also encourage you to limit attendance at these. Obviously, folks want to grieve, and we believe that that is appropriate and what should happen, but we would encourage you to limit attendance. And we want to give our strongest possible encouragement that older people or those with underlying health conditions although they are allowed to attend funerals, it should be extremely limited. And if those who are elderly or have underlying health conditions do attend, we urge you to exercise extreme caution because you are at much higher risk of developing serious COVID-19 illnesses. To be clear, a house of worship that performs a funeral is a one-time event directly associated with the funeral, and there are no ongoing religious services allowable at this point outside of funerals. We also want to provide a little clarification around restaurants. While, as Supervisor Cox mentioned, we are still waiting for the state of California to give us the green light on our regional variance plan that we submitted to them. And so because we are still waiting on that, to be clear, in-person dining in restaurants is not presently allowable. The state of California has said counties that meet the metrics will be given the approval. We believe we met these metrics. Our board voted. We received that information. We voted unanimously that we attest to meeting those criteria for both in-person dining and in-store retail. Those plans have been submitted to the state of California. They will review them. If they approve them at that point and that point only, will we be allowed in our county to have in-person restaurant dining. For our restaurants that are planning to open in-person dining, we've tried to make the compliance as simple as possible. If you go to our website, coronavirus-sd.com, there is a safe reopening plan designated specifically for restaurants that you can see. You download the form, you fill it out. You submit it to the County of San Diego, not for approval. We do not approve it, but you submit a copy so we have one on file. You post it publicly outside your restaurant. You share it with your employees, and then you are free to go once we get the okay from the state. The state of California has put out their own guidance around restaurants. We think you should use that as a guide. It should inform your thinking. But the only thing that you will be required to do once we get the go-ahead from the state is complete our safe reopening plan for restaurants, which is available on the county's website. Again, complete it, email a copy to the County of San Diego. That email is on the form. Post it outside your restaurant and share it with your staff. On beaches, we know San Diegans have been doing great, adhering to the guidelines. We know that we love our beaches. We know we're heading into a holiday weekend. And we want to let you know that we are working with the coastal cities, with the mayors and city managers and lifeguards who represent all of the jurisdictions who have beaches in San Diego County. And we are working with them on their ideas and suggestions around easing some of the restrictions on the beaches, potentially allowing things like sitting or staying or other types of things. We expect to hear back from them next week. And once we hear back from them and we take it under the advisement of our public health officer, then we hope to be in a position to ease some of those restrictions on beaches. But as we head into this Memorial Day weekend, we want everyone to remember the current restrictions in place will remain in place throughout the weekend. There is a requirement that you wear a face covering when within 6 feet of someone else. There's a requirement that non-household units remain 6 feet apart from one another. Also important to note that on the beach you can walk or run. You cannot be stationary or sit down. If your local beach allows dogs on the beach, then consistent with that local beach's rules, you can certainly take your dog. And then you can get in the water to swim, surf, paddleboard, kayak, snorkel, recreational boating in our ocean, bays, and lakes, but again, only with members of your own household. And beach parking lots remain closed and will remain closed at least through the weekend. All cities have the ultimate say as to whether their beaches are open, and so please be sure to check with your local jurisdictions. Quick update on testing at the Convention Center for Homeless. We are presently at 1,562 have tested negative. 4 have tested positive. All 4 of those were residents of the Convention Center and not staff. 3 tests are still pending results, and 27 are indeterminate, and we are awaiting retesting of those individuals. Before we jump into our charts, I just want to point out today is another milestone for us. This is our new single highest day testing totals. And I want to take a moment and commend our T3 staff and team led by Nick Mascione, the Director of Health and Human Services, along with everyone in our public health lab who are working tirelessly to break through the barriers to set up process and protocols, to get pop-up testing in place, to have our strike teams going out to skilled nursing facilities and other locations, to make sure that we are not only increasing our testing, but we are doing it in a thoughtful way that helps inform the actions we're taking surrounding coronavirus. And we obviously have a ways to go, and we want to continue to make progress, but we continue to see our testing numbers increase, and that does not happen on its own. That is a testament to a lot of folks who are working very hard, and we appreciate their work. So we'll jump into our T3 chart here. You'll see today we're reporting 4,802 tests, our new single-day highest number of totals. You'll also see in the chart there we're adding a 7-day rolling average. We're going to have day-to-day fluctuations. You can see our 7-day average there at just under 4,000 per day. We obviously want to get to our goal of 5,200. We would like that to be our 7-day average and not just a one-time occurrence, but we continue to see positive progress as it relates to testing. Total tests reported to date is 115,837. Just as our testing continues to increase, our tracing capacity continues to increase. We're now at 281 contact tracers and case investigators who are out every single day working with those who have tested positive, identifying their close contacts, reaching out to those folks, and doing everything we can to daily tackle and wrestle and control the spread of coronavirus. Total investigations performed now just shy of 7,500. Treatment 139 individuals in our public health rooms with over 700 cumulative. Out of today's total testing, we'll share with you the total positives. Again, this is encouraging. 4,802 tests performed today. 114 of those were positive. That is a 2% positive rate. That is below our 14-day rolling average of 3.6. As we continue to increase testing, we expect this number to continue to trend in a downward trajectory. Next, on hospitalizations, you will see a slight uptick in ICU utilization for COVID. Again, just about where we were 5 days ago in terms of 155. 387 total COVID-related hospitalizations, and you can see across here staying relatively stable as we move forward. Out of the 387 hospitalizations, you can now see where that is in relation to our total hospital system capacity. COVID plus non-COVID patients puts you at 3736, which gives us a healthy delta between the total bed capacity. These are the things that allow us, along with others, but these are the metrics along with others that allow us to feel comfortable in continuing to move forward with the responsible and phased reopening. Final chart is our cumulative stats here. You can see the cumulative positives, cumulated estimated recoveries, cumulative hospitalizations and ICUs. Most of value on this chart is the doubling rate of hospitalizations, ICUs, and then, of course, the unfortunate loss of life. That concludes my section of the report. I'll now turn it over to Dr. Wilma Wooten for her Public Health Officer's briefing.
Good afternoon, everyone, and thank you, Supervisor Fletcher. As is our practice, the global, national, and state statistics today are based on data from the Johns Hopkins dashboard. And this data was obtained today around noon. So, globally, there are almost 5 million positive cases, including almost 326,000 deaths. Nationwide, the United States is reporting over 1.5 million positive cases, which is still 31% of the global number, and includes almost 93,000 deaths. Statewide, California is reporting almost 84,000 positive cases, including 3,420 deaths. And today, the County of San Diego is reporting 6,140 cases, which is 114 more cases than we reported yesterday, as well as including 230 deaths, which includes 8 new deaths reported since yesterday. Our age range for the entire number of cases still remains from 3 months to 101 years of age. And also 51% of the total number is between the ages of 20 and 49 years of age. We still are essentially split for gender. 49% female, 51% male. And 1,155 or 19% of cases have been hospitalized, and this includes 351 individuals that have been admitted to the ICU, which is 6% of the total, and 30% of the total number of those hospitalized. For the 230 deaths, these represent approximately 4% of the total number of cases. And of these 8 additional deaths, the age range is from 61 to 99 years of age, and all of these individuals did have underlying medical conditions such as hypertension or diabetes or obesity. Of all of the 230 deaths, 43% are female and 57% are male. Regarding race and ethnicity of all deaths, we have data for 97%, which is 223. Of these, 43% were female, 57% were male. Regarding race and ethnicity of all deaths, we have data for 97%, which is 223 of the 230. And this means 7 individuals do not yet have race and ethnicity data. Of this total, 103 or 46% are white, 95 or 43% are Hispanic or Latino, 17 or 8% are Asian, 4 or 2% are Black or African American, 2 are Pacific Islanders, and 1 each is American Indian and of multiple races. The demographics for our county, the demographics for all of the information that I've shared with you thus far is available on our county website. And that is at the bottom of the screen here and on the sign in front of me. In regards to reporting outbreaks in congregate and community settings, to date we have had a cumulative total of 72 confirmed active outbreaks. Of these, 49 are in congregate facilities with a total of 1,351 cases, and this includes 112 deaths. And also we have 23 active outbreaks in community setting locations, which includes 310 cases and 5 deaths. The county is enormously grateful for the public's effort to date. And had we not practiced physical distancing and respected the stay-at-home order, as a united community, many thousands more individuals, including our elderly, would have died from COVID-19. As many of you may recall, 2 weeks ago, one of our partners at UCSD, Dr. Natasha Martin, presented how many deaths we would have had we not implemented any non-pharmaceutical interventions or social distancing strategies. And that was upward to anywhere from 12 to 15,000. Just today, another study was completed by the Big Cities Health Coalition, and that also confirmed those modeling results. So in my presentation to the Board of Supervisors yesterday, I noted that local efforts have put the county in a position to be considered by the state to be considered for accelerated stage 2. As Supervisor Fletcher has stated, we submitted that request last evening and are waiting to hear from the California Department of Public Health. This request is currently under consideration and would not have been possible without the efforts of the entire community to combat COVID-19. So thank you so very much. Now please welcome back to the podium our Chairman, Supervisor Cox.
Thank you, Dr. Wooten. We'll go directly to the questions. And again, please make sure you identify yourself by name and outlet if you're not introduced by those indicators. So we'll get started right away.
Matt Hoffman at KPBS, please state your question.
Hi, before the board voted to approve moving further into phase 2 yesterday, we heard from some of our hospital systems. UCSD Health and Palomar said that they supported the plan and had sat down with county health officials to review it in depth. But Sharp Healthcare and Scripps, who say they're treating more than half of the county's COVID patients, didn't support the move because they said, one, they didn't see the plan in advance, and they each had concerns about triggers relating to hospital bed capacity, especially with rising cases in the county, in the South County. Why were these two healthcare systems sort of like left in the dark when it came to crafting this plan?
Okay, I'm going to let Dr. Wooten respond.
Well, thank you for that question, and that's an interesting response. At our Chief Executive Officer meeting with the hospitals on Monday evening, before we submitted the application, we reviewed the application on Zoom or Skype with all of the CEOs, and everyone saw exactly the content that was submitted. And we did an earlier run-through with UCSD the morning before. So it was completed over the weekend, and we had our partners review it on Monday, and we submitted it on Tuesday evening. So that is so no one was left out. The information was shared as soon as we completed it, and that was, again, we completed the document without making other additions. That was completed Sunday, and on Monday, we shared it with our hospital partners.
And then just, I guess, so why do you think that they're saying that then? And then when you hear people like Scripps say they have concerns about hospital capacity, and, looking at Chula Vista, if we reopen businesses, that could potentially just be a even worse situation out there. I guess, how would you respond to that?
Well, I think you would have to ask them for why they responded in that manner. We've reviewed the application with them, and different people have different opinions. But a lot of it might be driven by the fact that we are on the border. Just yesterday, we had cases sent from Imperial County, and so we are very cognizant, and we have stated that throughout our presentations and even in our application, that because we are a border county, we have to be cognizant and carefully monitor what's going on the Tijuana side of the border, as well as to the east of us from our Imperial County partners.
Thank you.
Okay, let's go to the next question.
Danny Freeman from NBC7, please state your question.
Afternoon, all. I have two questions. First, for the supervisors, you've both said before that San Diego will not and cannot get ahead of the state in terms of loosening restrictions, and yet your board voted to essentially do just that with this pilot program proposal. What changed, and will this put the county in direct conflict with the state if the governor says no? And then a follow-up for Dr. Wooten, are you in support of the Phase 3 pilot program, and why?
I'll answer a part of that, and I'll turn it over to Supervisor Fletcher. But the board made a request on the accelerated pilot program for stage 3. We don't know whether the governor's going to approve it or not. We're certainly not going to jump into stage 3 until the governor either opens up stage 3 or responds back to our request for consideration for a limited acceleration of stage 3. But I'll let Supervisor Fletcher also respond.
Hey, Danny, I know there is a lot of confusion because there's a lot of different things going on, but just to reiterate, our board voted unanimously to attest that we meet the criteria to move all the way through stage 2. We've sent that plan to the state. We expect that they will approve it. We hope to hear back very soon. That was one item that was unanimous. Then we had a second vote about sending the governor a letter, and that letter was a request to do some additional things. And so we will wait to hear, but we're not able to do anything outside of state guidance. And so moving all the way through stage 2, we believe we meet the criteria they outlined. We voted unanimously to do that. We've submitted the plan. We hope to hear back and move through. The other one was merely a mechanism to send the governor a letter saying we would like to do some additional things in stage 3. And we'll see if we get a response, and we'll see if we get one. The governor's alluded to a lot of stage 3 activities. He thinks we'll get to at the beginning of June, which is awfully close to where we are now. So, we'll see. But we're not going to do anything outside of what the state outlines. They do have the authority on these issues, and so we will move consistent with the decisions that they make.
So the question again to me was, can someone repeat it?
And sure, no problem. Dr. Wooten, just for you, because I didn't hear you speak yesterday at the presentation specifically on the pilot phase 3 proposal, or that letter, as Supervisor Fletcher just said. Do you think that San Diego County is ready for some sort of pilot program like that, and why?
So, correction, our chief administrative officer spoke about the pilot program. I presented the information and the criteria and metrics for the attestation application, which includes our containment plan. And we have reviewed the pilot, and we selected elements that cause the least risk of potential impact in the community. So as Supervisor Fletcher stated, we have to look at businesses in terms of what type of intensity or impact they'll have, and also when people are frequenting those businesses, what's the duration and time that they're there. So it was a careful selection of businesses that we felt we could manage given the triggers that we have in place. We are very sensitive to the fact that our community wants to get back. So we are leaning forward, as we have throughout this pandemic, in coming up with solutions and strategies that will help us to get people back to work again.
Thank you.
Okay, let's go to the next question.
Brandon Lewis at CBS 8, please state your question.
Some smaller counties that had submitted their attestations to the state yesterday had their plans approved, and I'm wondering if you expect the county's plan will take longer given its size, and if you think restaurants and businesses might get an answer on this before the start of Memorial Day weekend.
Well, I know that Dr. Wooten has been in close contact with the State Department of Public Health, but I'll let her respond to the question.
Thank you for the question. The application that the County of San Diego submitted was different from the attestation plan that's on the website submitted by smaller jurisdictions. So it's a different document in terms of at least 4 or 5 different metrics. And I believe we might be one of the first. If you go to the website, you'll see when the last county was approved. And I believe it was about May 18th. So again, we are waiting to get a response. We did get a receipt or an email notifying us that the application had been received, and we are awaiting input about that application. Thank you.
Can you clarify when you got the receipt from the state, please? And if you think it'll happen by Memorial Day weekend for some businesses that are anxious to open?
Okay, I didn't hear your question. It's a bit muffled. Can you repeat it?
Sure. I was wondering, if you can clarify when you received the receipt from the state that they got the attestation, and if you think businesses or restaurants might get the go-ahead before the weekend.
So we submitted the application last evening, and I received an email receipt this morning about 6:38 a.m. that it was received. I don't know when we will get a response back, but we expect to get one hopefully this week. So I don't know, because again, if you go to the website, we are, I believe, one of the first larger urban jurisdictions to submit an application. So I am not sure when they'll send a response back, but from what we've heard, many jurisdictions get a response anywhere from 24 to 48 hours. I can't predict when they'll respond, but when they do, we will make that information public. And there was a second question?
Nope, you answered it. Thank you.
Thank you.
Okay, next question.
John Carroll at KPBS, please state your question.
Yes, earlier in this news conference, Supervisor Fletcher was talking about $17 million in economic stimulus for the hospitality industry, especially small businesses. I'm assuming that includes restaurants. But what I would like to ask is, last week, I believe it was, the governor, a former restaurateur himself, talked about the reopening of restaurants. He characterized it as profoundly challenging and that he was deeply concerned about it. Many as 50% could possibly not survive. Will the $17 million be enough to help San Diego restaurants? And if not, are you all considering any more help for them in the future? Thank
I'll
you.
ask Supervisor Fletcher to respond.
Thank you. The $17 million hasn't been allocated specifically. Our county staff is working to come up with a plan for how best to spend it, and I think the intent is to look at what state programs are available, what federal programs are available, and where can we step in to fill the gap. We're very mindful of the tremendous impact on small business and very mindful of the impact on the hospitality industry, with restaurants being a part of that in terms of they will have a much more challenging time recovering. We'll see what the total package looks like coming forward, but that's the sense at which we're moving into this. Look, I think that there are a number of industries that are going to be much more significantly impacted than others as we move forward. Certainly things around conventions and large gathering spaces, whether they be concerts or major sporting events or things that until there's a vaccine or therapeutic treatment will struggle. We may get to a point where obviously some of those are moving forward. But I think that it is a concern with our restaurants. Our restaurants historically operate on very thin margins to begin with. And when you start changing the number of folks who are there and you take into account their fixed cost, I think that it's an industry that we have to be particularly mindful of doing everything that we can to help. And so as additional funding becomes available, as we progress through this and we gain more information about what the impacts are and what is happening, then we'll continually be in a position to try and reassess. I would say that the overwhelming majority, though, of the economic assistance is going to be derived primarily from the federal government. Local governments do not have the ability legally or constitutionally to deficit spend, and we will all face significant budgetary challenges, which is why in every time of economic distress and difficulty, both local governments, state governments, as well as business entities and regular folks and workers tend to look to the federal government for the stimulus type efforts. And so we hope that those efforts continue. We hope the federal government continues to provide more help and relief to local governments, to individuals, and to businesses, but we'll certainly do all that we can.
Thank you.
Okay, let's go to the first text question. I believe it has to do with testing in our jails. Dr. Wooten will respond.
Yes, this question is from Kelly Davis with the Union Tribune. To date, the Sheriff's Department has tested 263 inmates. There are currently 3,700 people in custody, and dozens are cycling through the jails each day. The Sheriff's Department said yesterday there are no plans to test all of the inmates. What is the county's position on inmate testing?
Well, first of all, in clarification of the numbers, when we vaccinated inmates across the 7 jails, it was approximately 6,000 individuals. So we meet weekly, if not even more often with our, weekly or every other 2 weeks with the jail medicals, the jail or the Sheriff's Department's medical staff. And I believe now it's been at least 2 or 3 weeks ago, we offered testing within the jails. So we started out with intake. So we've been testing at the 3 intake locations. And we will also be testing those that are already in the jails, starting out with individuals that have symptoms. And we have also offered for asymptomatic inmates as well as staff to be tested. So it's a tiered approach, if you will, and we are in continuous conversations with the medical staff related to these various strategies and how we can make sure that we can test this vulnerable population. And I just might also add that vulnerable populations is a part of the attestation application, SNFs, correctional system, as well as those that are homeless.
And this question is from Jared Whitlock, who is freelancing for the Voice of San Diego. For San Diego County to reach routine COVID-19 testing at all nursing homes, Dr. Wooten had said last week during a webinar that the region must add capacity. How much more testing is needed to be added to reach this goal?
Well, how much more testing? Our goal is first to identify who should be tested. So as you may be aware, if you've seen our priority levels, individuals in congregate living facilities is a priority. for the County of San Diego. They are also a priority at the state level as well. So our goal is to start, and we have been, starting with the SNFs that are having outbreaks, starting with those and other congregate care facilities. But to start with those and to identify, offer testing for staff and for residents. And we've done that, and we are cycling through that. And then we will lead into other SNFs that do not have outbreaks. We also have a contract with the UCSD for them to also work with the SNFs in their catchment area. And of the 87 SNFs, skilled nursing facilities in the County of San Diego, 20 are within the UCSD's catchment, and we are working with other hospitals to establish a contract to do the same.
All right, thank you, Dr. Wooten.
This next question deals with testing in the backcountry, and Nick Machion will respond to that question.
Yes, this question is from Michael Hart with Julian News. Are there any plans to increase testing in the backcountry? Currently, we have to travel 60-plus miles for testing.
Thank you for that question. As part of our testing strategy, it's to achieve all corners of the county. Comprehensive accessibility are very key. And so that point about traveling long distance is what we're trying to break down. So for our backcountry area, we've been working with some of the clinics currently. The closest one right now for the North Inland area is Escondido. And then for East County, it's El Cajon. But we have to far exceed that. So we're actually working with our CAL FIRE and our County Fire Authority and just started this past weekend, testing and working with our EMTs, our emergency medical technicians, who are able to do tests. And we're looking at 5 locations throughout the backcountry area, and we'll be giving more details later this week for the general public, which will be starting next week.
Thank you, Thank you, Nick Machion.
This next question deals with the classification of COVID deaths, and Dr. Wooten will respond.
This is from Eric with CBS 8. The county is reporting nearly half of those who have died from COVID-19 are in congregate living facilities like nursing homes. Mm-hmm. The county is also reporting that 97% of the deaths were people who had underlying medical conditions. County Supervisor Jim Desmond is quoted as saying San Diego has only had 6 pure solely coronavirus deaths. Is that accurate? If so, where does that number come from, and is that posted on a public site?
So all of our demographic information is on our county's website at www.coronavirus-sandiego.com. There's information for the case counts, for hospitalizations and death, and even much more. So our deaths are our deaths. I think I went through a very detailed description of how when we look at our death certificates, how the death certificates are completed. So we have 230 deaths as reported today. All but 6, and it's still 6, of the 230 have underlying medical conditions. And underlying medical conditions could be someone could have hypertension, someone could have just diabetes, someone could have just asthma, someone could have congestive heart disease, or someone could have multiple morbidities as we call them. But basically they could have multiple conditions. And a large number of our population has 2 or more or 3 or more underlying medical conditions or chronic diseases. So a death is not just a pure, there is no category or definition of a pure COVID death. If COVID-19 is related to the underlying cause of death, and as I explained Monday, if you died from a respiratory failure, that could have been due to pneumonia, which could have been due to COVID-19, and that is in part 1 of the death certificate. Part 2 has other contributing medical conditions not necessarily related to the death, but other underlying medical conditions that the person has. So that is the way that we document or account for deaths. And also we do a cross-analysis between those individuals that test positive for COVID-19 and whether or not it is on our death certificates, and we see a pretty good match with that.
All right, thank you. I think you kind of covered two questions with one answer. This next one is from Mike McKinnon at KUSI. Florida has allowed their residents to reopen their businesses, and their death rate has remained very low. If Governor Newsom prevents San Diego County from moving into phase 3, would the county think about following their lead and allowing our residents to get back to work anyway?
I think everyone here that's spoken to the public today and in the past has stated that we are aligning ourselves with the state. So we will continue to do that. There are opportunities where we do a little leaning forward, but in many cases, that those leaning forward efforts occur, and in many cases, sometimes the state agrees, or they might do that as well. But at any point, our strategy is to align with the state.
And I have one last question from Cliff Albert at Kogo. Based on the long lines on the first day of opening of the local casinos, Viejas, have you reviewed plans by the other casinos for their opening this week?
Actually, yesterday I reviewed the plan for Barona, and we've, as I previously have stated, reviewed the plans for Hamul and Sequan. So those are the three plans that I have reviewed so far, and I hope I will have the opportunity to review others. Thank you.
Well, that concludes our questions for today, but let me close by noting that this week is the 46th anniversary of Emergency Medical Service Week across the nation. This week is set aside annually to honor and celebrate the work of our emergency medical service personnel. There are more than 10,000 credentialed EMS workers in our region, which includes EMTs, paramedics, and authorized registered nurses. They work on fire engines, ambulances, helicopters, boats, law enforcement vehicles, and bicycles. San Diego County's EMS workers transport more than 250,000 patients in ambulances last year. This year, we owe them a special thanks, as our region's EMS personnel have truly been on the front line of responding to this pandemic, while also responding to the many other medical emergencies they deal with on a regular basis. So, thank you to all EMS personnel. Before we go, I want to remind everyone that we will not have a media briefing tomorrow, but our communications office will send out an update with the latest data and other information. We'll return here Friday at 2:30 for our next briefing. Until then, remember to stay in place, maintain space, and cover your face. Thank you.